Carrie, what does an assessment for a child that has autism involve when we're trying to choose an augmentative or alternative mode of communication?
Well, there are so many things that I'm just going to hit on the most important factors right now. First of all, it's good to keep in mind that this is very different than your typical speech and language evaluation, where that's usually looking at a child's abilities at one point in time. This is definitely a process that can take anywhere from 2 weeks to 3 months. So we're looking at their ability to use different types of devices over a period of time. Also, another important thing to keep in mind is that although we're a very important part in this process, we definitely have to work with a group of professionals. Also, the most important people, as we've mentioned before, the family and the student themselves. Additionally, you will want to collaborate with the classroom teacher if they're in an academic environment, get an occupational therapist, a physical therapist, and sometimes even a vision specialist to help out, as well as an alternative technology specialist. All of these people will come together to look at what's the best type of communication for that child. Once we've looked at all of those factors that we considered on the previous question, then we want to hypothesize what devices do we think are going to be most effective for this student. At that time, we might pick 1, 2, 3 devices and give anywhere, like I said, from 2 weeks to 3 months for each device, have a very specific system for collecting data on each of those devices, and make sure we're collecting data across different communicative contexts. So for example, at home, maybe at an after-school program in the community, and also at school. Once we've looked at how well the child does with all of these devices, we can decide which ones, if any, of those 3 would be the one that we really want to focus in on. At that time, we might do another trial, which can take another 3 months because, especially if this is a high-tech device, this is a very big investment that we're making. So we want to make sure that this is a device that not only is going to be successful for the student right now, but we want to make sure this is a system that can grow with the student in the future as well. Finally, once we've looked at all of that, we want to make sure that they're going to have support to be able to maintain the system and help for it to grow as the student grows.
Interesting. From your experience, what have you seen that has really benefited the student?
Well, I'm going to talk about, and it's great that you bring this up, because a lot of times I talk about device, but a mode of communication doesn't have to be even a light tech, what we would call more of a static device, or a high tech, like the dynamic computer-like screen devices, but it can be something no tech or very light tech. So I would give an example of a student who came into the school where I'm working at 3.5 years old, who was obviously communicating, but not in the most effective ways. So when I say communicating, maybe tantruming, screaming, hitting to get the attention that this child wanted in order to get what the child wanted. Obviously, this was very stressful for the child, for his family, and for all of us in the environment. So we just offered some type of picture exchange communication system for the child, and some students take to it very quickly and others obviously take a longer time. This child went through there are 6 phases to this particular communication system, went through the phases extremely quickly, and we went from a student who was primarily hitting his head on a wall or screaming to get what he wanted, who was able to look from a field of 20 plus different icons and tell us exactly what he wanted. And this probably happened within less than a typical school year, so about a 6-month period of time. Not only was it obviously gratifying for us, but you can imagine how excited the family was to really be able to know what their child was asking for.
Wow, that is very inspirational. And I think it's something that a lot of clinicians and graduate students will need to hear. Sometimes it's a struggle to work with this population. Any words of wisdom for a clinician working with this population to stay motivated, to look on the bright side, or positive words of wisdom from your experience?
Well, definitely. I think we're all told to have realistic goals. You know, we set realistic goals for ourselves, right? Whether you're a graduate student or a clinician or just in life. I think we also need to set realistic goals for our therapy and for our students. Not only ourselves, but help parents to have realistic goals. So in this case, what I just described, for me, I get goosebumps talking about it. It's still a very inspirational story. However, if we had been waiting for this particular child to get verbal speech in 6 months, we would have been disappointed. We would not have seen this as a success. So what I would say is that make sure you're looking at what's really realistic for that student as their next step, and just feel how exciting it is, no matter what, that they've accomplished that goal.
Carrie, thank you very much for coming to talk to us today.
Oh, it was a pleasure to be here.